Dear students, let us start learning various case or scenario-based questions that can be asked in physiology along with the explanations. Mr. H. Jayawal, age 45 years, goes to a physician complaining of weakness, increased frequency of urination, increased appetite and increased thirst. He also complains of poor healing of wounds, numbness in his lower limbs. Examination shows body mass index 28 kg per meter square. Lab investigation shows fasting blood glucose 150 mg per deciliter, postprandial blood glucose 320 mg per deciliter, glycated hemoglobin 7.8%. What is the basis for polyuria seen in diabetes mellitus? If you look at the graph, we have something called renal threshold. That is, as long as plasma blood glucose level is 180 to 200 mg per deciliter, whatever glucose that is being filtered will be completely reabsorbed and no glucose will be excreted in the urine. But more than renal threshold value, that is of 200 mg per deciliter, the glucose will start excreting in the urine. So increased glucose in the urine also cause excretion of large amount of water along with it, that is results in osmotic diuresis, and this results in increased frequency of urination, which is called as polyuria. What is the basis for polydipsia seen in diabetes mellitus? Polydipsia is increased thirst. Because of polyuria that is seen in diabetes mellitus, there is increase in water loss from the body. This causes increase in plasma osmolarity level. Increased plasma osmolarity now stimulates the osmoreceptors, which in turn stimulates the third center, which is located at hypothalamus, and this results in increased thirst sensation, which is called as polydipsia. What is the basis for polyphagia seen in diabetes mellitus? In the diagram, you can see LH, that is lateral hypothalamus, and VMN, that is ventromedial nucleus of hypothalamus. Insulin is required by ventromedial nucleus of hypothalamus, which is called satiety center, for the glucose uptake, which in turn inhibits feeding center, that is lateral hypothalamus. In the patient of diabetes mellitus, due to the lack of insulin, glucose is not taken up by the satiety center, so it cannot inhibit the feeding center. This results in continuous activation of feeding center, results in increased appetite, which is called as polyphagia. For further explanation, please visit my YouTube channel. Thank you. Happy learning.